time for the panel today on this is Pankaj Gupta from Mithomanja Partners. I'll be your host, and we have CEO of Excellent Life, Mr. Victor Brown, on the call, who will be also the moderator of the event. So he has all the fantastic questions for you that I'm sure you will be answering in a few minutes or so. But one request I have to everybody is that this is going to be a very interactive session. So even if you are sitting in the audience and you have some opinions, some insights, some questions, please feel free to jump in and ask your questions or express your opinion. You can unmute yourself or you can type your questions in the chat. And I'm sure the panelists will be extremely glad to answer your questions. From here, I will pass it on to Victor. Please, Victor, go ahead.
Well, thank you, Pankaj, for putting together this panel. I think it's an opportune time to talk about population health and corporate wellness, given that we are presently, unfortunately, in a global pandemic. And I'm sure each of us understand and have been impacted in some way of these circumstances. And so wellness and health is paramount and top of mind for a lot of individuals and organizations. So Excellent Life and as a representative for Excellent Life, really excited to be a part of this conversation, to bring some true thought leaders to the table and get insights into some of the trends, some of the challenges, and some of the opportunities around corporate wellness and population health. And just to really, get things started, I'd love to kind of, start out by having some of our distinguished panel introduce themselves, just a short, minute blurb so that the audience understands how blessed we are to have, these panelists take part in this conversation. I will start with you, Thomas, and I'm looking at my screen, so I'm coming, kind of, organized fashion. But Thomas, if you don't mind giving a quick introduction of yourself.
Sure, and thank you for inviting me to attend this panel. I'm Thomas Johnson. I'm Executive Director of the Population Health Alliance. I've been in this position since May the 1st. And the Population Health Alliance represents companies, nonprofits that are interested in forwarding the best practices in population health management.
Really appreciate that. Excited to have you be a part of this panel. Sinead, do you mind giving a quick introduction of yourself?
Not a problem. Thankfully, hopefully you hear me okay now. Thanks, okay. Yes, you did able to do that. Sinead Borgersen. I'm Senior Director at CEI, and I also sit on several for-profit and non-profit boards, including some bigger ones with that do prescriptions around the world and breaking into that. And this year, obviously, I think you've seen HR and benefits particularly really have to step up their game over the last 15 months, especially worldwide. So very excited to be here and learn from the other panelists and the audience as well.
Awesome, pleasure to have you here. And we've had a few changes. We had some last minute travel pop up for Dale Smith, and Dale Smith was representing Acclinate, which is an incredible company doing some great work in population health. He's actually on a plane right now and can't make it, but we're also very fortunate enough to have kind of unofficial distinguished panel in Dr. Hammami, and then I probably brutalized your name, so if you don't mind introducing yourself and giving us some insight to what you do.
Thank you, Victor. Actually, you didn't butcher it as much as other people would do. Mouhanad Hammami. I am in Detroit, Michigan. I'm CEO of Global Health Consultants, which is a global health consulting company. But in my previous lives, I served as the Chief Health Officer for Wayne County in Michigan, which is one of the most populous counties in the state, almost 2 million people with 34 cities. I also served at Trinity Health, which is a national health system, as Senior Vice President for Community Health and Wellbeing. Good to be with you.
Pleasure to have you. And our last panelist here, definitely not least, I would love for you to introduce yourself, Saralynn, and provide some insight to who we have, and so the audience knows how blessed we are again.
Wonderful. Thanks, Victor. I'm Saralynn Malott and really excited to be here today. I lead people operations at Grabango, which is a leading tech company in checkout free technology and the AI space. And prior to that, I've been leading people operations for a little over 15 years for a variety of tech companies in the Bay Area. So really excited to be here.
Awesome. Pleasure to have you. And just a quick overview of myself. I'm founder, CEO of Excellent Life. My name is Victor Brown. Again, very fortunate to be moderating this panel. Excellent Life is a digital health and wellness company where we provide a software platform and mobile app to empower health and wellness. And we do that in some very innovative ways using AI and really focused on our mission, which is to improve the quality of life for all by advancing wellness. And now is an opportunity for us to do that in empowering incredible stakeholders like you all to make a difference in the world. And so now with that, I want to kick off kind of the panel, and I want this to be a general conversation piece that provides insight to the audience. So this question really goes out to any of the panelists. You all have, different backgrounds, but all distinguished. I am very interested in understanding what you see now in terms of growing trends as it pertains to corporate wellness and population health. And the second part of that question is, what are the opportunities within those trends to really empower health? Would love to get your insights. Anybody want to tackle that one first?
I did I put my hand up, right?
Yes.
I was back in school, right. Yeah, I was always Hermione in the Harry Potter. That's who I identified with. So I definitely, mental health and mental wellness just really came to the forefront over the last 15 months. Even my poor husband, who's been a remote worker for 6 years, very happily, suddenly ended up with 3 new co-workers he didn't ask for, right, with the pandemic. And every home was going through this, where it was a combination of school, work, social, family, industry, all in the home. And that's if you were lucky enough to have a home and you were lucky enough to keep it during what was going on. So that just was, it was really definitely a boiler keg. And I think that's for a lot of professionals in people ops and health and benefits. We saw that it was a need that needed to be expressed. And the EAP, that kind of band-aid that we had, token gesture, I'm sorry to say, in a lot of times, really wasn't cutting it. So I'm a construction electrical design, the company I worked at. I was in tech and I moved over here to learn. And we actually had stand downs for mental health, which if you told me, a year earlier that we would have, big construction guys on a job site stopping and checking in on each other and their mental health, I would have called you probably a lot of names and said you were a liar. And where I see next is using technology. I don't think we're going to get this back out of, people have now got more comfortable, like having a webinar like this, having teletherapy. That is huge. And I think we can't go backwards. We can't demand that we do that. And the other thing that surprised me, because my sisters are in maternity, is that preemie babies dropped worldwide. But there was some good out of it, which was nice to hear. So that was my take.
Thank you, Sinead. I think those are very important points. And yeah, so any other panelists? I'm definitely curious about other insights. Echo your sentiments, Sinead.
Yeah, this is Thomas. I'll mention a couple things that I think are similar to what have been brought up, but maybe with painting a little bit of a different brush. So one thing I'm involved in is I'm the board chair of a local nonprofit in the Washington, D.C. area that, among other things, operates a behavioral health clinic. And clearly we saw with the combination of COVID and also the social unrest that took place surrounding the George Floyd incident, we saw a real uptick in anxiety and depression amongst the people that we served. And I think the other thing that we saw was an increased reliance upon new tools and techniques that I agree probably aren't going away, whether that's telehealth, and you see both at the federal level and also at the state level, new laws and regulations to promote telehealth as a tool for providers to use with their patients. And I would say, like Excellent Life has, a huge increase in the number of mobile apps and digital health tools that also help patients measure themselves. And I think that that helps all types of companies in the wellness space, be they large or be they small. I think the goals are very similar to try and hopefully monitor and control cost of healthcare, monitor activity, getting patients to serve as consumers, and really monitor on a day-to-day basis what's going on with their health. And I think all of those things fall within the population health umbrella. So there has been a huge change in healthcare. I would also add that I think that Wall Street has noticed this, and I think the investors in healthcare are increasing exponentially amongst Wall Street, and I think that you will continue to see that trend.
Well, I think you hit on two things that really resonated with me that I didn't really think about, was the connection between social unrest and mental health. I mean, I think, I had compartmentalized those two things to be something different, but they're part of the same coin. And I think that's really important. And certainly, those words resonate with me, given some of the circumstances that we're now dealing with in our society. So thank you for bringing it up. And, I absolutely agree that technology is going to be a tool that is pervasive in terms of how we solve some of these challenges. Saralynn, I can see you kind of nodding your head. Yes, Dr. Hammami.
I would like to add to what Thomas was saying. I think one thing that the pandemic has exposed is what we always advocated for and talked about, which is the social impact of health. And it highlighted the disparities and inequities in how the pandemic affected certain groups versus others. And that is, I think, the silver lining that we benefited from in understanding the social burden of health. And even though with the telehealth and all the technology tools that we might have and we put in place, there is still that digital divide, where we saw that even in children attending school at home, where they might have only 4 children might be sharing one computer versus 4 children with 4 computers and all that. So that impacted, the pandemic has impacted how we practice technology and putting it to health. And it certainly highlighted the need to address social care as an integrated thing to clinical care. And especially when we talk about corporate wellness, in a corporation that is 1,000 and above in terms of total people that work there, this is like a small community. Even within that corporation, you would have the disparities. You would have those that need more attention because of socioeconomic things versus those that probably do not need much. And this is where a corporation need to understand the fabric and the demographics of their workers and how can they support them and can they offer them help.
Right, I definitely appreciate that. And to kind of piggyback off of what you just said, I think there's something you might describe as good corporate citizenship. And, there's a certain obligation that I think as a corporation that should be part of the culture, where they understand that they're part of a community that serves people. and should feel a certain amount of obligation to ensuring the livelihood of those people. I would also say that absolutely there's a financial impact to having your employees be more healthy and well. We understand that business rationale, but there's also being a good corporate citizen as well. And I would love to have you chime in, Saralynn, and give some of your thoughts as well.
Absolutely.
Thank you.
I agree with everyone, what you've said so far. One thing that I would say I've noticed over the last several months, at least a little over a year now, and even saying that out loud is hard to believe, certainly mental health, but we're all navigating through ambiguity, right? There's not a one size fits all. I often say it's a one size fits one. And so it's important to understand the data and analytics as it relates to market trends and the various resources available. But what I think is even more important is creating a space, a safe space for employees to share their needs and really leading with empathy. And so something that we do here at Grabango is surveying our employees and surveying them often because it's ever changing. And so how they felt 6 months ago is not how they feel today, and making sure that we are giving everyone a voice. Our core values here include people matter and inclusion. So really fostering an environment that welcomes all and understanding that what works for you might not work for your peers or individuals that you're working with on a regular basis, and having an understanding for what their experiences are help us then turn insights into action and really implement solutions that are specific and unique to your employee demographic.
Yeah, that was amazing. I think you just gave testimony to what I was referring to when I say good corporate citizen. That is a perfect kind of characterization of what is a part of being a good corporate citizen, and the approach that you take where there's actually a concern and care for the individuals that you serve. So thank you for bringing that to the table. And so we see, all of these things that I think are providing, great insights. And I would be remiss if I didn't recognize some of the audience as well, because I know I'm looking at the audience and I'm seeing some incredible individuals that I know personally that have deep insights. I would like to welcome you all to really chime in, ask questions, make comments, unmute yourself. If you're hearing something that resonates or you have, a thought about what's been said so far, I do want this to be, a very, interactive dialogue that we all can walk away with feeling inspired and feeling empowered with maybe some knowledge that we didn't know coming into this conversation. Another question, given that, I have your focus time right now in this panel, is that when we think about corporate wellness and when we think about population health, they're very similar in terms of kind of the application. But I'd like for you all to provide some insights. And we talked a little bit about, technology and how it's being used, about where are you seeing some of the challenges and hurdles with really taking advantage of kind of the technical capabilities that we have versus what is getting implemented. Like, and we at Excellent Life, we're seeing some hurdles that we're having to get past that limit kind of the capacity of everything that we can do given technical capacity. But what are you all seeing, and how do we as a society or as businesses get past some of those hurdles so that we can get this technology out there to service the people in a better way?
Yeah, this is Thomas. I think one challenge moving forward, I mean, we've talked about, I think specifically how technology and telehealth is a strong tool in the behavioral health space. I think one challenge for employers in this new age of the pandemic and of using Zoom and of a lot of employers maybe not using as much office space and letting more workers work remotely. One thing I think you're going to see is how employers react to that in terms of their workplace health initiatives. Because all of a sudden, you may not have employees, having access to a gym because they may not have access to that at their homes. And employers may have to see if they can make some type of adjustment to make sure that people are still participating in that type of health initiative. Should it be part of their workplace health initiative? I think also, just generally speaking, when you're in an office together, there's a collective spirit in that office to try and see if everyone can participate in a workplace health initiative and help reach certain goals. The question is, if you've got more people working remotely, is that going to have an effect on people participating in those health initiatives remotely? Because all of a sudden, really, you have a different type of pressure because everyone isn't in the office like they used to be. And that collegiate spirit could potentially wane, especially as you have new employees coming in and they might not have initially been part of that collegiate spirit. So, I think workplace health initiatives are going to be challenged in this new environment, especially if there are more and more remote employees.
Yeah, I think that's a great point. And I'd say at Excellent Life, even before the pandemic, what we saw was an emerging trend of some organizations understanding some efficiencies they could gain by having more remote workers. And so that trend wasn't developing as quickly until you get to the pandemic, and we're forced to do that. So what we do is that we think that engaging individuals in a very kind of personalized way in their remote locations is key to ensuring that you have kind of the greatest participation in those programs. So we take measures in our application to ensure that engagement is there, even though that individual may not have access to a gym or have the normal groups that they would be involved in. So we have to do it in a different way now. Thank you.
I want to take it from a different angle, especially when we talk about population health and the possibilities of what technology can bring, as well as what are some of the challenges. So both you, Victor, and Saralynn talked a little bit, touch upon artificial intelligence and machine learning. We know that this is a very powerful tool that we can feed the machines to start identifying people at risk, specifically when we talk about people that might have a social risk factor. So getting someone from a certain zip code who might experience homelessness or food insecurity or what have you is a must in clinical care to identify those. If we can have a predictive model that says John Doe from zip code so-and-so or neighborhood zip so-and-so needs to be given extra attention or screened for the social risk factors, that would be the ultimate thing to do. However, the challenge is feeding the data into that model. There is no solid, real-time, accurate data that we can get into such model where we can benefit from AI, similar to how we use it in clinical care. You can now feed cardiovascular markers and predict the risk of stroke versus somebody else. So this is still where I think the challenge is. So I think a key focus on how can we have data that is so specific to a zip code or even a census tract to feed a model that can highlight the social risk factors. That would be my ultimate goal out of this.
Well, thank you very much, Dr. Hammami, for serving up a great ball straight down the middle of the plate for Excellent Life, because that is exactly the type of attitude we have, belief we have, that really analyzing the data in a highly personalized way so that there can be the proper risk kind of mitigation and techniques put in place so that we can prevent those illnesses before those conditions manifest themselves. So there's a lot of work that needs to be done there, but that's the path that we're heading down, and hope that through dialogues like this and collaboration of some incredible individuals, we'll get there soon. Yes, sir, Lynn.
Yeah, I'd love to add to some of the challenges that I think we're seeing, especially in this dynamic with regard to working remote. burnout is real. And so we're definitely seeing burnout as a trend that we as leaders in this space need to mitigate. And so it's important to leverage your technology as resources for your employees and your workforce. With that said, I think it's also important to be intentional about creating a balance. And so having resources that help improve the employee experience is important, but also understanding that there's a need for disconnecting and having that heads down space. You hear a lot about Zoom fatigue. You know, we're used to being in office and having that human interaction, as Thomas said, that camaraderie. And when you're on Zoom calls all day and then you still have your job to do, it's important to make sure that employees feel that you as a leader understand that technology is great, but to not have that same interaction that you do when you're in office can definitely contribute to mental health and concerns that have been brought to the forefront. And so I think it's important to not only continue providing resources through the technology form, but also to get back to the basics so that employees have time to decompress and have a balance.
Absolutely. I think that balance is key. And oftentimes I think we get caught up in the midst of all the craziness of, you know, this one goal or this overarching goal. And we're failing to realize that underneath that goal, we have to have balance. No matter how much merit that goal has, whether it's good health, whether it's, you know, being, you know, lowering costs associated with that, all great things. But if we're not taking care of self and having a balanced approach, then ultimately we're not maximizing that goal or the outcome of that goal. So thank you for that.
I have to add, and I very much appreciate the other panelists' comments on this too. It is about making sure that whether it's an employee in the corporate world or whether it's somebody in the community, they're feeling that psychological safety from the people that are supporting them, to be able to say it's okay to not be okay, and it's okay to make sure that you put your health first. I know that we have pivoted to making it very free now to use their sick days as a mental health day. There's no, you know, people stop coming up with an excuse to take the day, because we found that nobody was taking their time off in the last year, and they were very much burning out, and they felt like, well, I can't go anywhere and I want to save it up for when I can go somewhere, but at the same time just not actually taking a day just to turn it off and be disconnected from work. And we saw that inside and outside of work, so, and across a lot of different fields too. Also, I think the other thing that is driving a lot of the innovation is all of us, you know, corporations have to step up our game. The labor market's got a lot tighter, and your benefits has to be really a part of your total rewards now. So not just what's the salary, it's they're asking very, very, not just, oh, do you have medical, do you have dental? Give me the array, and how are you supporting me in my home life as well, you know? So that's the thing that we're seeing too.
Absolutely a key, again, to having a more comprehensive and holistic approach to ensuring health and wellness. And in the midst of that, in the midst of this global pandemic, one thing that, and I think it was kind of alluded to before, and is that the investor community, Wall Street, has noticed this as well. So there's a lot of money that's flowing into health and wellness, digital health, all these, you know, different buzzwords that you hear. My concern, and I'm wondering, you know, what you guys feel, is that money is flowing into this area in a very generalized way, but without the real true expertise leading where that money is being directed, that ultimately we're not getting the impact we need, because it's more of a shotgun approach without true understanding of how to empower the applications that can empower society and better health. What are your thoughts around where the money is being directed and how we can ensure that investments are going to really the progress of society?
I can speak to that, and I'm just going to use an example. In a prior life, I used to run an organization called the Medicaid Health Plans of America. Essentially, those were health insurance companies that were in the Medicaid business, either fully or partially. And initially, when HMOs started to really get into managing Medicaid population, Wall Street did not really notice that industry until about the early 2000s. And I think you've seen a lot of consolidation since then, as Wall Street has invested in that industry. I can tell you that I think that for the most part, I think that those health plans have continued to provide quality care to those individuals that they serve. However, I think one of the keys with doing that is making sure that the regulators at the federal and state level have the right amount of oversight to make sure that those needs are served on behalf of those who have enrolled in those plans. Because you're right, you're talking about a lot of money. And usually with money comes a desire for return on investment. And I think when you have a system like we have, I think it's possible to accomplish that. But those who are regulating those companies in that market have to take their jobs seriously. And I think when that happens, you can find strong private public partnerships that I think will operate in the best interest of the consumer, which is, I would think, what we're all about if we are, in the business of healthcare. So, I don't see it as something to be highly concerned about, but I think the regulators at the federal and state level have to do their part.
Thank you for those insights. And to add to that, I guess, one of the reasons that I have a fair level of concern here is that I think oftentimes innovation comes about by way of, some major events, let's say global pandemic. And so now we're on the, dealing with this global pandemic, and there's innovation that's available to us. I think a lot of times the mindset of let's do things kind of the same old way and just pour more fuel on that same old way doesn't really open up the opportunities that we have in front of us. And it's just more difficult to move innovation forward. And I'll give you a really quick, kind of example of what my thoughts are. When I think about telehealth and telemedicine, there's certainly value there. But in terms of data analytics, historically, telehealth, telemedicine doesn't solve their problem. We're going to the doctor once a year if we're being good about managing our health and wellness, unless we're already sick. That data is too sparse. But today we have available to us wearable devices, things that can collect our data. We believe at Excellent Life that it's really important to really collect that data in a much more granular way, then understand it so that we can see the signatures of good health and bad health. And those kind of approaches, we're seeing there are more hurdles in getting those things out there versus kind of the standard, like this is the way we have done it, let's put more fuel and more gas on that. And so that's where, some of my thoughts were coming from.
That's a very good point, Victor. I think one of the things that came out as a positive outcome of the pandemic is how we caught up with the use of technology in healthcare. Healthcare was always 10 years behind when in our daily life. How many of us go visit a bank now? You do online banking, you order everything online, all that. However, the idea that I'm going to see my doctor through a screen, or I'm going to use healthcare through my desktop or mobile phone or tablet was still an alien concept. The pandemic forced us, and it actually forced the providers. When health systems started seeing that they are not getting their revenue from the in-person care, it forced them to shift into telehealth and telemedicine, which was supposed to happen at least 20 years ago. But there was that hesitancy, there was that lack of will to invest in the technology, there was that also behavior from the consumer side. The patient always wanted to see their doctor. Now I think it is here to stay, and we're going to see a new way of healthcare delivery that is going to catch up with everything else that we do online. You don't have to see your doctor in the same room. We're talking, some people now are in Singapore, some people are in DC, some people are in Detroit, and here we are, we're all talking together. And this is what the future of healthcare should go in that direction.
Yeah, absolutely agree with you. And just to kind of pour fuel on the fire, give a point of reference. I came from the energy sector. So I'm coming into healthcare, being in healthcare 6 years now. I have a different perspective. And I'll give this, kind of analogy. In the energy sector, we have what we call critical assets. Some of those assets are part of our national security. And I would often ask individuals, would it be a smart idea to let a nuclear reactor start to melt down and then go in and try to fix it after it starts melting down? Most people would likely say, no, that's not a good idea. But I find it very troubling that that is the standard that we bear in healthcare. And so the crux of so many of the issues is in the approach that we take and not understanding kind of the daily operations of the human body in a very granular way. And I think really solving, that fundamental approach and the data gap, the opportunities to really change and transform healthcare are unbelievable. It's a different arena once we start taking care of those fundamental things. So I'm also seeing some comments here, and they're coming in. And one of the comments was about risk stratification, or in particular around, some of the chronic conditions. And I think that comment really ties into the data that we're capturing, or that we can capture, and understanding, where those risks are. So I think that is a very important point, that risk stratification has to be part of what we do within the corporate wellness environment and also population health, because that, in essence, is going to get us the biggest bang for our buck and make the world a better place by making us healthy.
I think if I may jump in here, I would also love to get some feedback or some questions from the audience if they have any kind of insights or questions from their own perspective.
Hi, this is Sean. I have a question for the panel. Appreciating how important technology is, especially in this day and age, and AI with respect to healthcare, and being able to make some incredible advances. My question goes to, how do you translate the ability to use, or the use of that technology and AI, to the fact that, especially now, since many people are working remotely, there's not the same interaction within the workplace, or just in general right now because of the pandemic. When you're focusing on some of the older populations who are not as techno savvy, how do you, or what kinds of outreach or trainings or educational opportunities do you see to help reach the people who are not as techno savvy, so that they're positioned so that they can be empowered by being able to use these various technologies that are out there?
Let me, I'll speak to that just to cite one example. And this was something that was taking place actually before the pandemic. I can tell you that the organization that I chair, that I spoke of earlier, had a partnership with the local AARP chapter to address that very issue of improving literacy with social media and all of these applications. And I think the audience that took advantage of those tools actually were extremely appreciative that they were having individuals really kind of walk through how to become more proficient in this new world that we have of social media and applications and all those types of things. So I think partnering with a number of different types of groups that directly either serve or are constituents of especially the older community, I think is crucial to improving their ability to operate in this new world.
Yeah, definitely.
I completely agree. I think another real life example is when we started with the COVID vaccine, the target population, as you all know, we started with those that are 65 years and older. And we established a registry online for those senior citizens to access an appointment database and request their appointments and all that. And they were completely lost. They could not use it. Everyone was calling and saying, we don't know what to do and all that. So I think the key is twofold. One, the technology should be simple and very user-friendly to a basic level. And second, ensure whenever we're rolling a new tool to have enough support, especially during the early learning phases, to have that senior citizen that doesn't know what to do or where to start, have that hotline, that real person that is walking them through the process. And then they learn. I mean, 5 years ago, we probably would have never thought that my grandmother can get on video chat and Zoom or Facebook and all that. It is happening. They can learn it and they learn it very fast. But I think at least the first 6 months of rolling out any technology tool should be heavily supported. And we have to start from a very basic level.
Agreed. And again, great insight. This is a great conversation for me. And what you gentlemen both said kind of made me think about the panelists that were supposed to be here, but could not make it due to travel. With Acclinate and Dale Smith, who was planning on being on this panel, they're taking a very innovative approach as well, which I find very interesting, because a part of what we need to communicate is going out to an underserved community, Black and Brown individuals, where healthcare disparity has really, been prevalent. One of the challenges is because that community is distrusting of certain communications, in particular as it pertains to healthcare, clinical trials, and things of that nature, rightfully so. What Acclinate does is that they understand how to communicate to that community, and they're focusing a lot of their efforts on communicating health information specifically in that community in a way that resonates. And what they found is that a lot of times selling data in terms of what the data shows, or making a point in the way that we would normally make a point, doesn't resonate with that community. That for that community, it's more the testimonials. So they're spending a lot of time filming individuals who have gone through a process and had, incredible results going through that process, that are a part of that community. And they're putting that out there in the community so that people that community trusts can give them the message of, I've gone through this process and this is the results that I've received. And I think that approach is a very smart approach. And this conversation made me think of that and really understand how we're missing that piece of it is a part of what they represent. Because I probably didn't characterize his company as well as I should have, but I will say that Excellent Life is fortunate enough to be working with Acclinate in terms of them using our technology to really get their message out there and understand the analytics of the data that they're capturing.
Well, look, there is no question. We are, as I think advanced as we are in terms of the tools that we've talked about, in terms of the information that's out there, in terms of the partnerships, I think a lot of companies and nonprofits have been able to put together. The thing that we are all fighting is misinformation. And there is misinformation about one very big subject these days in the healthcare space. And I think that it calls on us to be extremely vigilant, to reach out to those voices that people trust. Because, in many cases, they may not trust a company. They may not trust a trade association like mine. And in certain cases, they may not even trust the government. But, they will trust certain voices that I think they see not having a personal interest, for lack of a better word, other than to see that consumers really understand these tools and they use them in the right manner and that they can trust them.
Yeah, I think that's really important. And again, and maybe I need to challenge myself, because I think a lot of us that are in this conversation right now are probably, trained in certain ways where the scientific approach makes sense, it's logical. You bring facts to the table, we evaluate those facts, and we can make decisions based on those facts. But in a world that is operating, where there's not a stable kind of consideration of facts that seems to change, do we truly need to operate in a different way to get the results and the outcomes that we're looking to get? And to your point, Thomas, maybe it's getting the right individuals to carry the message, and not spend so much time on all the data and the facts. There's a part of what we have to do that involves that, but there's a certain audience that's just not going to work. That's not an effective approach. And, this conversation is helping me to realize that. So thank you for those thoughts.
And also with humans, we resonate better with storytelling, right? Nobody here, if you ask them to give me, all of who can remember the proofs of all the algorithms they did in school, but I bet you can remember the first fairy stories that you heard, and the stories that you heard about, Peter and the Wolf, and the lessons and the morals that come out of those. So we're more connected to that. So we found, even with getting our folks, because we're, obviously looking at vaccines and vaccine mandate that may be coming down in the States that was announced, is doing some storytelling and having some of our more trusted people, if that's the CEO, if it's ourselves, meet with people where they are and listen to them, and say, okay, and why would you think that? And let them express their fear to be able to understand, and express also what we need as a company. And so we found that even in the communications we're doing with them, that we've had to engage more story modes and more videos, just to help to build that trust up too. But I think it really comes back to, storytelling.
Yeah, that's a great point. I think storytelling is a tried and true way of getting the attention of the audience that you're trying to target. And sometimes that can be easily missed, because again, coming from kind of the scientific world, we want to present these facts and figures because we understand that this is our validation, this is our proof. But it truly is the storytelling that helps connect you emotionally to that audience. A very, very valid point. Given that, I ask, we have, a lot of people, a lot of insight, on this call. What are some things that vendors that are pushing innovation can be doing a better job at? so that that innovation has a faster adoption curve. I'm curious to get some of your thoughts on that topic.
Don't overpromise. when you're selling this benefits, please stop overpromising things. Get to show us how we can easily integrate it. We've got so many things going on, competing for budgets or competing for attention. And so often the simplest things will help us when we're making decisions on how to get it out, and know that our systems aren't perfect. No, I think we definitely saw that with COVID, and just even the first rollout of the, Affordable Care Act, right? And then, and again and again after that, we have to make it very much from the customer point of view, the consumer point of view, not just from the business point of view to integrate it. So, yes, some of us are very comfortable with technology. A lot of folks aren't. And unless we make it that simple, we're always going to struggle with whatever they're bringing, even if it's the best thing in the world.
Yeah, I think that's a really important point, and that really is a great message that resonates with me, because as a vendor, the approach that you inherently take as a business is that you're raising your hand saying, hey, I'm the best, we're the greatest, and you can easily get caught up into that mindset. But the other side of that is that you're building up a set of expectations with the goal of getting access, and then when you get access, you have to make sure that there is a meeting of expectation, over delivering. And that's a balancing act that I think vendors need to be very proficient at. So a very good point that you made, Sinead.
I completely agree. I think any innovation should have three components: simplicity, accessibility, and affordability. And those three should be the key to whatever vendors are putting out there. It might be the best tool, but if you do not know how to use it or you cannot afford it, then it's going to still be just for a small portion of people, not for everybody to use.
Great point. Great point. This is a great conversation, because I've got my own perspective in terms of how to grow excellent life, but to hear perspective of these experts is really good for my understanding as well. So certainly appreciate this conversation. Another thought that I think is really prevalent is that we are all kind of on this call, or we do what we do because there's a natural interest in health and wellness. This is what the panel is about. So I'm curious as to what you as individual panelists do that really make you feel good about the work and the efforts that you're putting into. What is your measure of hey, I've done a good job today? And so I'd like to kind of understand that about you as individuals. And,
well,
and
I would say, one thing that, I've only been in this position since May 1st. But one thing that I've walked away from, and I think I, would thank my board with this, is that, they actually are allowing me early on in my tenure here to be innovative with the association. We are going to be engaging in a number of new offerings that I think get very specific about the things that the Population Health Alliance is concerned about, and really try and make an imprint in a lot of areas, like social determinants of health, like health equality, like patient engagement, behavioral health, a number of areas where I think probably we were involved maybe kind of at a general level, but weren't as maybe specifically focused as we're going to be. And so I was able to present that early on in my tenure here, and the board agreed with me. And I think the fact that the board is allowing me to try and provide some innovation with this organization that I think will make it stronger, I think is something that, brings me to work every day with a strong spirit. knowing that as much as we've done, we can do more. And I think the times call for that.
You're on mute, Victor.
Definitely appreciate that. Thank
Let me finish.
Glad you have that latitude. Would love to get your thoughts as well, Dr. Hammami.
Yeah, I completely agree with what Thomas said. Most of my career has been in the public health and community health sector. And I think what drives me is the concept of complete wellness. As an MD in medical school, at least my days when I graduated, we were taught that every disease has clinical causes. No one has ever taught us that the stomach ache might be hunger, or the depression might be loneliness. And I think this is what, during my practice in public health, had opened my eyes to the social determinants. So complete wellness, only if we take the 8 elements of wellness, physical care is only one. Physical wellness is 1/8 of everything else. So there has to be financial wellness, occupational wellness, spiritual wellness, all those together. And this is where we can say a community is well. And that's the core of what I work in. And Victor, you talked about corporate responsibility or community, being a community citizen. Every corporation, whether it's in healthcare or in the industry or in electronics or technology or whatever, can impact the community where it is. And that is what we call the anchor mission. By investing locally, hiring locally, being environmentally responsible, all those coming together can add to what constitutes a well community. And this is my vision towards going forward. All our patients are coming from the community. They bring with them issues that they encountered in the community. They come see the provider, they go back to the community. If we do not correct what caused that illness in the community, then they're going to come back again and again and again, which is against what we are advocating for in terms of population health.
Very, very true. Thank you for those words as well. What about you, Saralynn?
Yeah, I love this question. I think for me, certainly what drives the work that I do is creating a space that people enjoy. And so really wanting to make sure that employees feel seen and valued. And this year, one of our accolades is that Grabango was recognized as best companies for diversity and women. And that was really helpful for us to know that we're not just saying these are part of our core values, but creating tangible initiatives that create that space. We often spend more time with our work families than our own. And so making sure that we're creating that safe space that people enjoy is what drives me as a leader in this space.
That is totally awesome, and I'm glad that those core things that are driving you, because I think that's an important part of the equation. And Sinead, what are some of the things that really get you feeling great about what you do on a day-to-day basis?
I actually took a course and got supported by my former chief people officer here at CEI to become a mental health first aid instructor. Okay. And so, they paid for the courses and are paying for us actually to not only bring it into our company, but as you said, talking about community, Dr. Hammami was talking about there, really looking at as if, suicide is very high amongst construction workers. It's a much a kind of profession. Hey, I don't go to the doctor. We know that men generally aren't good at going to the doctor. They don't have that OB/GYN check-in that women do that kind of train you into going to a doctor yearly. So on top of that, obviously the mental health thing. So it was important for us not only to address mental health support and wellness with our own company, but also in our community. And I used to work for WebEx years ago. So I've helped them with the mental health organization too, with helping to kind of bring it into Zoom. and tips and tricks and showing them to do it to do virtual, because that's a different medium too, to try and connect with people to do it virtually as well. So for me, that was something that I was really appreciative of, and hearing that, you know, getting calls from employees who I don't think I mean, you'd occasionally get a call and say, thank you for helping me get to that doctor, you know, maybe as a HR, you know, business partner across the world. But now it's definitely more on like, thank you. I felt seen and understanding helped, and, you know, it makes all the rest of the HR stuff that sometimes we have to do a lot more bearable when you're able to help somebody.
It definitely resonates with me, and so you know, I think that same question for myself. I know that every amount of work that I put into this is a part of my purpose, which is ultimately to make the world a better place. And certainly, you know, that has helped me get through, you know, some of the hurdles that as innovation kind of leader in a space that has not historically been very innovative, that can create hurdles for you and challenges. I think that mindset of working on purpose has you know, played out well for what we've been able to accomplish. That said, I want to be conscious of time. I know this has been a great conversation. I'm holding back other people that I have to meet with today because I'm saying this conversation is going too well. However, we do have to kind of wrap up, and I would like to thank the panelists for being a part of this conversation, and also the audience. It's been very interactive. I feel very fortunate to be part of this conversation, and like to offer up an opportunity to connect further beyond this, because I think we're all going to play an important role in driving health and wellness, and I believe collaboration is a key. So I am one that is very open to collaborating, and hope that, and we will be a part of making this world a better place, which is our mission. I'll also, Pankaj, would you like to say a few words before we wrap up as a sponsor?
I'm again really thankful of the audience and panelists for such an insightful discussion. And again, Victor, great job on the panel. I think you moderated really well. So again, thanks everybody for joining the panel today and expressing your feedback, your opinion. Would love to connect with you again in a few days and weeks, and probably collaborate more. Yeah, that's it from my side. Thanks a lot, Victor.
Thank you all. So we're going to wrap up here, and hopefully y'all have a great rest of the day from where you're calling in from, or a good night if you're calling in from Singapore, perhaps.
Exactly. Thanks a lot, everybody. Take care.
Thank you. Bye-bye.